Have you noticed that you feel more tired than you used to, even on days when you haven't done very much? Maybe you wake up in the morning and still feel exhausted. Maybe walking across the parking lot leaves you strangely drained. Maybe a flight of stairs now feels like a small mountain. And like many people over 60, you may have told yourself something very familiar. I guess this is just part of getting older. That explanation is incredibly common. In fact, it is one of the most common things cardiologists hear from patients when they finally come in for an evaluation. But here is something many people do not realize. Sometimes fatigue is not simply aging. Sometimes it is not poor sleep. Sometimes it is not stress or a busy day. Sometimes fatigue is the heart quietly asking for attention. In many cases of heart disease, the earliest symptom is not dramatic chest pain. It is not a sudden collapse. It is not even severe shortness of breath. It is simply a slow change in energy. A person who used to feel comfortable doing everyday activities begins to notice that those same activities require more effort. Walking becomes slower. Tasks take longer. Rest breaks become more frequent. And because the change happens gradually, it is very easy to overlook. Today, I want to talk with you about when fatigue may be more than normal tiredness, why heart problems can cause it, how heart-related fatigue often feels different from ordinary exhaustion, and the warning signs that should never be ignored, especially if you are over the age of 60. Because the truth is, the heart rarely goes from perfectly healthy to seriously ill overnight. Most of the time, it sends small signals first, and fatigue is one of the most common signals it sends. To understand why this happens, we first need to talk about what the heart actually does for your energy level. Every cell in your body requires oxygen and nutrients in order to produce energy. Your muscles, your brain, your organs, every part of your body depends on a constant supply of oxygen-rich blood. Your heart is the pump that makes this possible. With every heartbeat, the heart pushes blood through a vast network of arteries and blood vessels, delivering oxygen and nutrients to tissues throughout the body. When this system is working well, your muscles receive the fuel they need to function efficiently. Walking, climbing stairs, carrying groceries, and performing everyday tasks feel manageable. But if the heart begins to struggle even slightly, the delivery system becomes less efficient. When muscles and organs receive less oxygen during activity, the body responds with one of the most basic signals it has: fatigue. Instead of feeling sharp pain, many people simply feel that their energy is not what it used to be. Tasks that once felt effortless begin to feel heavier. You may find yourself stopping more often while walking. You may need more time to recover after activity. You may feel a general sense of reduced stamina. This kind of fatigue is not the same as feeling sleepy. Many people with heart-related fatigue sleep through the night but still wake up feeling drained. Others describe it as a kind of heaviness in the body, as if their muscles simply do not have the same strength or endurance they once had. And because this change can develop slowly, people often attribute it to aging. But aging itself does not suddenly remove energy from the body. When fatigue appears unexpectedly or worsens over time, it is often worth looking deeper. One common heart-related cause of fatigue is reduced blood flow to the heart muscle itself. This happens in a condition known as coronary artery disease. Over many years, fatty deposits called plaque can accumulate inside the arteries that supply blood to the heart. As plaque builds up, these arteries can narrow. When the heart muscle does not receive enough oxygen-rich blood during activity, it cannot pump as effectively as it should. This reduced pumping efficiency affects the entire circulation system, and one of the earliest ways the body may signal this change is through fatigue. Many people expect coronary artery disease to cause chest pain first. But in older adults, fatigue can sometimes appear earlier than pain. Instead of sharp discomfort, a person may simply notice that their stamina has declined. Someone who once walked comfortably for 30 minutes may now feel exhausted after 15. A person who used to climb stairs easily may now feel unusually drained halfway up. Because these changes often appear gradually, they can be easy to dismiss. But when energy levels drop without a clear explanation, it is important to consider whether circulation might be involved. Another condition where fatigue frequently appears is heart failure. Despite its alarming name, heart failure does not mean the heart has stopped working. It means the heart is not pumping blood as effectively as it should. In heart failure, the heart muscle may become weak or stiff. When this happens, it cannot move blood through the body as efficiently. As a result, muscles and organs receive less oxygen during activity. This leads to one of the most common symptoms of heart failure: fatigue. People with early heart failure often notice that their endurance changes. They may begin to tire more easily during everyday activities. Walking long distances becomes more difficult. Carrying groceries feels heavier. Climbing stairs becomes more exhausting than it used to be. In many cases, fatigue appears before more dramatic symptoms. Later on, people may also develop shortness of breath, swelling in the ankles, or rapid weight gain caused by fluid retention. But in the early stages, fatigue may be the only noticeable change. Another heart-related cause of fatigue involves abnormal heart rhythms. Your heart normally beats in a steady, coordinated pattern that allows it to pump blood efficiently. But sometimes the rhythm becomes irregular. One of the most common rhythm disorders in older adults is atrial fibrillation. In atrial fibrillation, the heart's upper chambers beat irregularly and often rapidly. This irregular rhythm can reduce the heart's pumping efficiency. When circulation becomes less efficient, the body may not receive consistent oxygen delivery. And once again, the result may be fatigue. Some people with atrial fibrillation feel strong palpitations or an awareness of their heartbeat, but others notice only that they feel unusually tired or weak. They may simply feel that their energy has declined without a clear reason. Heart valve problems can also produce fatigue. Inside the heart are 4 valves that control the direction of blood flow. These valves open and close with each heartbeat. If a valve becomes narrowed or leaky, the heart must work harder to move blood forward. Over time, this extra strain can reduce circulation efficiency. And when circulation becomes less effective, fatigue may appear. In many cases of valve disease, fatigue develops gradually. A person may simply notice that they cannot do as much as they once could without becoming tired. They may feel winded more easily or need more time to recover after activity. Because these changes are subtle at first, they are often overlooked. One reason fatigue is so commonly ignored is that it feels vague. Chest pain is unmistakable. Sudden shortness of breath is alarming. But fatigue feels ordinary. Everyone gets tired from time to time, and that makes it easy to dismiss. People often blame fatigue on poor sleep, busy schedules, stress aging, or simply being out of shape. Sometimes those explanations are correct, but sometimes fatigue is the body's earliest signal that something deeper is changing. Cardiologists often hear patients say the same thing. They say, "Looking back, I realize I was getting tired much more easily than before." They say, "I thought I was just slowing down." They say, "I thought I was just out of shape." And sometimes those early signs appear weeks or months before a heart problem is discovered. Of course, fatigue does not automatically mean heart disease. Many conditions can affect energy levels. Anemia can reduce oxygen delivery to the body. Thyroid disorders can disrupt metabolism. Chronic lung disease can make breathing less efficient. Sleep disorders such as sleep apnea can cause daytime exhaustion. Diabetes, infections, depression, and medication side effects can also cause fatigue. That is why fatigue should never be diagnosed at home, but it also should not be ignored when it becomes persistent or unexplained. There are certain patterns of fatigue that deserve special attention. One important warning sign is fatigue that appears during physical activity. If walking short distances, climbing stairs, or performing simple chores suddenly feels much more exhausting than it used to, your body may be signaling a change in circulation. Another warning sign is fatigue that appears together with shortness of breath. When the heart struggles to pump efficiently, fluid can sometimes build up in the lungs. This can make breathing feel more difficult during activity. The combination of fatigue and breathlessness is an important signal that should be evaluated. Swelling in the ankles or lower legs is another sign that may appear with heart-related fatigue. When the heart cannot move blood forward effectively, fluid may accumulate in the lower part of the body. If fatigue appears together with ankle swelling, medical evaluation is especially important. Dizziness or lightheadedness can also occur when circulation is not adequate. If fatigue appears along with dizziness, fainting, or near-fainting episodes, this should never be ignored. A sudden change in stamina is also significant. If you could comfortably walk a certain distance a few months ago but now struggle to complete the same distance, something has changed. Even if the cause is not heart disease, it is worth understanding. Fatigue deserves particular attention in women over 60. Women sometimes experience heart disease differently than men. While chest pain is still common, women are more likely to report symptoms such as fatigue, breathlessness, nausea, or unusual weakness. Some women who later develop heart disease recall feeling overwhelming fatigue days or weeks beforehand. This fatigue may feel very different from ordinary tiredness. It may appear suddenly and feel disproportionate to daily activity. Because it does not resemble the classic chest pain, many people expect it may be overlooked. That is why unexplained fatigue should never be dismissed. When evaluating fatigue, doctors typically begin by asking detailed questions. They may ask when the fatigue began and how it has changed over time. They may ask whether it appears during activity or at rest. They may ask about sleep medications, diet, and medical history. A physical examination helps evaluate circulation, heart rhythm, and fluid retention. Doctors may also order tests. Blood tests can identify anemia, thyroid problems, or other conditions. An electrocardiogram can evaluate heart rhythm. An echocardiogram can assess how well the heart is pumping. Stress tests can evaluate how the heart performs during activity. These tests help determine whether fatigue is related to the heart or another medical condition. If fatigue appears suddenly, worsens quickly, or occurs together with chest discomfort, severe breathlessness, or fainting, emergency care should be sought immediately. Those symptoms may indicate a serious heart problem. But even when fatigue is less dramatic, it should be discussed with a doctor if it persists or interferes with daily life. The earlier a problem is identified, the easier it is often to manage. Alongside medical evaluation, there are also habits that help support heart health and energy levels. Regular physical activity helps strengthen the heart and improve circulation. Even simple daily walking can make a meaningful difference. Balanced meals provide nutrients needed for energy production. Adequate sleep allows the body to recover and maintain healthy metabolism. Managing blood pressure, cholesterol, and blood sugar reduces strain on the heart. Avoiding smoking and limiting alcohol also protect cardiovascular health. These habits cannot replace medical care when symptoms appear, but they support long-term heart function and overall vitality. Perhaps the most important thing is learning to listen to your body. You know your own energy level better than anyone else. If something feels different, it is worth paying attention. Fatigue is easy to overlook because it feels ordinary. But when it appears without a clear reason, persists over time, or combines with other symptoms, it may be the body's way of asking for attention. The heart often sends quiet signals before serious problems develop. Recognizing those signals early can make a significant difference. Fatigue is one of the most common symptoms people experience after the age of 60. Most of the time, it has simple explanations. But sometimes fatigue is the first warning sign that the heart is under strain. That is why changes in energy should never be ignored too quickly. If your stamina has declined noticeably, if everyday activities leave you unusually drained, or if fatigue appears together with breathlessness, swelling, dizziness, or chest discomfort, it is time to talk with your doctor. Early evaluation can identify problems before they become serious. And in heart health, early detection often leads to better outcomes. Remember this simple idea. Your body usually tells you when something has changed, and when fatigue feels different from ordinary tiredness, it may be worth listening carefully, because sometimes the heart's earliest warning sign is not pain. Sometimes it is simply a loss of energy.